Child Life Specialists, our goal is to try to help minimize the stress and anxiety that the hospital environment places on kids and families. We try to make this a better place to be. Our goal is to try to help kids understand, first of all, what's happening with themselves, with their bodies, and prepare them for anything that they're going to encounter in this world of healthcare. So we use a variety of different techniques to do that, but our backgrounds are in child development. So what we do is we gear it down onto a level that kids can understand, and we use dolls, teaching dolls, we use real medical equipment, we use pictures, we use a variety of different resources to be able to do that, and try to help normalize the environment. So we do a lot of play-based types of activities with kids. In the hospital environment, they have so much control and all that taken away from them, but really what kids know best is how to play. That's what their work is. So our job is to try to continue that normal growth and development so they don't fall behind developmentally when they spend a lot of time in the hospital, but then also give them an outlet for their creativity and just the ability to be able to be kids.
And the children say he could laugh and play just the same as you and me.
A number of years ago when Aflac was moving to Omaha and they were going to open an Omaha office, they were looking to establish a relationship with the pediatric oncology department. Our department essentially runs off of donations. We don't really have a budget to be able to purchase things. So all of the toys, pretty much all the toys that I have over in the treatment center, all the crafts, I have craft activities there. I have a small kid-sized table and chairs. There's movies to watch, video games. All of those normalization kinds of things were all purchased with the Aflac money. I wouldn't have any of those without that. I also have some teaching materials that I use. There are some really nice medical play dolls that have real medical equipment that we can teach kids about having an Infusiport or a central line. So before they go and have that placed, I'm able to show them in a safe sort of a way what an actual Infusiport looks like, what it's like on a doll. We even can play through what it's like to have that Infusiport accessed. And we also use money for our families that are newly diagnosed. They all receive kind of a little welcome bag, and in that there's always snacks in there. There are resources geared towards families, books that talk about the new diagnosis, and we have books that are geared towards children. All of those things are things we're able to provide to them from Aflac. I want to say to them, thank you from the bottom of my heart. I always say that I would not be able to do what I do without their support. All of the items I use every day in my job are things that I wouldn't have if there wasn't someone out there in the community that was supporting us. And they're just an amazing group of people. They've given so much to us already. They step up every year and provide this holiday party for the families to be able to come. And they don't always get to be able to participate in those kinds of things out in the real world when their child's on treatment. So to have a gathering that they can come and be with other families that maybe they haven't had an opportunity to meet, other families that are going through the same thing. They get to see the staff out away from the hospital environment and get to see them in a more normal environment, so it helps build those relationships. And I just want to say thank you from the bottom of my heart, because there's no way that we could do all that we do for those patients and families if we didn't have the support of Aflac.